Welcome everybody to the Board of Health meeting. I have an opening statement that is required to be read, which says, in accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting today, September 21st, 2021, on the Zoom platform and in accordance with the town's policy directive and guidelines issued on April 1st, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken via roll call. We'll start with an attendance roll call. I'll announce your name and please reply. For members of the public, please unmute yourself when I've opened the meeting to public comment. So for roll call, Alma Healy.
Present.
Okay. Deborah Green.
Present.
Mark Haddad.
Present.
Okay. And Jill Block, I'm here. So please note, everybody, that for the chat function is disabled by the town for security risks and potential bombers. So if you are adding comments during any portion of this meeting, you will need to, if you wish to speak, you're going to need to raise your hands and you'll be called on it.
Concord Board of Health.
Okay, so please, if you're not speaking now, please.
I am, because Melita is trying to get the town to do more with the masking and vaccinations.
Okay, so
I'm going to mute everyone and then unmute the board.
okay, thank you. Okay, I'm unmuted, or can people hear me? Okay.
Yes.
Mark is, Alma is.
Okay, so for any participant that wishes to speak during later parts of this meeting, you'll need to raise your hands and will be called on in order. And when you're called on, you'll need to state your names and addresses, please, for the public record. So moving on, the first item on our agenda are public hearings on request for variances for the on-site sewer disposal systems. First, we'll discuss 26 and 46 Revolutionary Road, a request for variance from Title V. Is there somebody here, Doug Andrisic or
Mr. Seidel.
Mr. Seidel, that wishes to speak about this?
Madam Chair, Brian Goodrow with Hancock is representing the applicant, Mr. Slidell. If it pleases the board, maybe I pull up the plan so we can have a graphic while I kind of describe the relief. Can I share screen? So what you see before you is an exhibit plan of land referencing 26 and 46 Revolutionary Road. 26 Revolutionary Road is where Mr. Slidell, the applicant, lives. He also owns 46, which is the direct abutter to the south of his property. Now, the reason why we're here before you this evening is Mr. Slidell would like to put in a pool. And in order to do so, he needs to adjust the lot line between his two parcels, so in between 26 and 46 Revolutionary. Now, topographically, the only area on 26 that is an appropriate kind of flat area is behind his existing house. It's also the south-facing side of his house. You put a pool on the south-facing side so you can get some sun. So the reason why he's citing the pool in the location it is because it's the area that makes the most sense. Now, the reason why we're before the board this evening is twofold. To put the pool behind the existing house and adjust the lot line will be 16.5 feet off of the pool. The pool itself will be 17.5 feet from the existing system on 46 Revolutionary. The second piece of relief that we're seeking is the fact that the existing system on 46 will be 1 foot off of the proposed lot line. Now, what we've done on 46 is we conducted official soil testing, and as a part of that, we kind of exposed and uncovered the edges of the existing system. We fully evaluated the existing system to understand where groundwater is at. Stan was out there witnessing our soil testing to make sure that 46 did have an opportunity to have a new system designed on that lot that is compliant with Title V. Now, as a part of kind of that soil testing, we had asked the agent whether or not he would either consider us reconfiguring the existing system or potentially coming before this board and asking for relief. And his suggestion was to come before the board this evening, seeking these two variances for kind of those two pieces of relief that were required. In terms of future ownership, should these variances be granted and down the road 46 be sold by the applicant, Mr. Slidell, obviously these will be part of the public record. They'll be fully documented with the Board of Health as in chain of title. So any future owner would be have full knowledge of any relief that is being granted here. In 2020, the existing system on 46 did pass Title V, so in the current configuration with bedrooms in the household, it's a valid system. So I mean, I guess with that said, and in summary, we're here before you this evening to answer questions again for kind of these two critical pieces of relief. One, the setback of the pool to the existing system, so the pool on 26 to the system on 46, down to 17.5 feet, and then the proposed lot line on 46 to the existing system of 1 foot. And with that said, I'm happy to answer questions from the board.
Thank you for that. One question I have, and I'm confused when I look at the drawings, you're talking about proposed property lines, but on the drawings, it says former property lines. Have you changed the lot lines already?
Not yet, no. So this is an exhibit plan, pending kind of the conversation and potential relief being granted this evening. We would then file an A&R plan with the planning board and have that recorded to formally change the lot line. But no, that has not been done. We've not been before the planning board yet, and nothing has gone on record. So what is considered the former property line is still a proposed condition. That is actually the existing property line between 26 and 46. And that's the gray line with the rock wall symbol. And then the darker line bounding parcel A is going to be the proposed lot line.
Do other board members have questions for Mr. Goudreau?
So did I hear correctly that you could fit a conforming system on lot, the new, number 46 lot?
So we haven't efforted a full design. What we've done is official soil testing, so we know we have naturally occurring material 4 feet. We understand what the texture is. We understand groundwater elevation, so we could then design a system. As I indicated, 46 has a passing Title V, and in its current bedroom configuration, it has a system that works.
Right. So it currently passes, but what you're proposing puts both lots out of compliance. Is that right?
Correct. The pool setback and the existing system.
Right. Are there other questions on this?
Wait, why are you coming to us first? Why not try to get the property line approved, the property line change approved first? Like, why come here first?
So the property line adjustment is an A&R. A&R stands for approval not required. As long as we conform to all underlying zoning within this district, it's a formality. So really, it's more the relief from the Board of Health that's driving whether or not we can change the property line. Because if we move the property line to create a nonconformity on 46, I mean, that jeopardizes occupancy of the house, does it not?
Well, it would cause us, if approval's not granted, it would cause us to order the owner of 46 to upgrade the system into full compliance.
Exactly. So we're here this evening kind of trying to overcome that situation before we create a non-conformity.
And how old is the existing system?
70s estimated. There's no plans of record that we found. So during the Title V inspection in 2020, the inspector indicated that it's ballpark 70s.
Okay. Susan, do you want to share your comments on this?
Well, my comments are that they're going to, if the lot line change goes through, they're going to put the septic system at 46 Revolutionary Road into non-compliance voluntarily, which is, you're not supposed to voluntarily put your septic system into non-compliance with Title V. So that wouldn't be something I would recommend. And if the lot line is changed and they want to put the pool in, they're going to need another variance to put the pool in because it will only be 16 or 17 feet from the leach field, and it should be 20. So we would potentially deny that too.
Right. And it looks like there are alternative locations that this could be put in without putting either system out of compliance. Is that right?
Potentially. I mean, again, we've done soil testing to understand that we do have, fundamental criteria to redesign a new system on 46. Now, I guess the question becomes, what is the intent of this? Let's start with the setback to property line for a system. Breakout's 15 feet. The requirement is 10 feet to a property line. So what does that 10 feet actually do? The 10 foot would potentially provide access around the system. And because Mr. Seidel is the property owner of both parcels, he could potentially grant that access as a part of, the variance, should this board issue a variance on the existing system for setback, could grant a Title V easement that provides the same level of access. It's just the fact that the property line kind of needs to be where it is because that's where the pool has to go, and as a part of that, the surrounding deck and patio. So if there's an overwhelming concern about meeting the intent of Title V, I believe by granting a variance, I believe we can accomplish the same goal through the granting of an easement coupled with that variance should the board so wish.
It looks like from the reports that it's possible that the piping in the leach field extends beyond what is known, and that the stone could extend beyond the proposed new lot line, right? So you don't have a full picture in place. Some of it is speculative, right?
We have a statement that the piping from the land surveyor, that the piping is 1 foot from the lot line. But we don't know I don't know how much stone is surrounding the field because we don't have the original plan unless they've done enough digging out on site to understand what the extent of the stone is. But the leach field is not just the piping, it's also the stone.
Mm-hmm. Right.
Correct. So again, as a part of that soil testing that we did, and Stan was out there with us, we exposed corners of the system to understand exactly where it is. So we feel comfortable representing the setback distances that we have on the plan.
Okay.
Right, but even then you'd have if you then did the swimming pool, you'd have a swimming pool that was closer than the 20 feet. That's not an access issue. That's a closeness to a septic, having a swimming pool. You didn't speak to that difference, right?
So the swimming pool is 17.5 feet off of the existing system, and if the board is not inclined to grant that specific variance, we would have to go back and see if we could find 2.5 feet. Again, it's a setback distance to leach field. It's a pool, it's gunite, it's watertight. I think the intent, again, is to make sure that we're not getting breakout into the pool from the effluent field, and just by nature of a septic system and the distance of relief being asked for, 2.5 feet, the breakout being 15 feet, and the pool itself being entirely watertight, I think we're still a reasonable ask.
So how many variances are being requested tonight? I mean, there's so many. Go ahead.
Yep, 2 variances. So 26 Revolutionary Road is seeking a variance for pool setback to the existing system on 46 Revolutionary Road from 20 feet to 17.5 feet. But 46 Revolutionary Road is looking for a setback variance to property line of 1 foot from 10 feet of the existing system. So 2 variances in total, 1 for each lot.
And so, Susan, what are the consequences of 2 systems being voluntarily out of compliance?
Well, we don't usually let people put their septic systems into voluntary non-compliance.
I think that sets a bad precedent.
I agree. I mean, we often grant variances for septic systems that are being upgraded that cannot completely meet Title V, and I think that you'll hear that one in the next hearing for Hayward Mill Road. But to let someone just voluntarily put their system out of compliance, and until this moment, the applicant has not offered to grant an easement to access the leach field from the other property. And, now we'll end up with 16 or 17 feet if that leach field has to be upgraded. I'm concerned that just constructing the pool might interfere with the leach field or damage the leach field. And I'm looking at the letter from the applicant's Andrysik Land Surveying, which says they're asking for 16.5 feet from the pool to the soil absorption area, not 17.5 feet. So now I'm not clear whether it's 16.5 or 17.5, but I was told 16.5.
Mm-hmm.
I mean, I think Title V says conformance with the code is presumed to be protective of public health. That's if you look at the staff notes I sent you, under 15.401 general provisions. In general, full compliance with the provisions of 310 CMR 15 is presumed to be necessary for the protection of public health, safety, welfare, and the environment. So that's kind of the standard that I would hold this to, since this is a voluntary situation.
Mm-hmm. So you would recommend not to grant the waiver?
I would.
And I would agree with that, because I mean, I think there's not an issue that has to be dealt with now. It's because the homeowner wants to put in a pool. If they want to put in a pool, that's great. They can put in a pool, but then part of the cost of putting in a pool is to upgrade the septic system on the other site to be in compliance. It sounds like it's a 50-year-old system anyway, so it's going to have to be upgraded at some point. It seems like that's just part of, if you want to do that pool project, that's part of what you have to do.
That's right. Or you locate it somewhere else where it doesn't put the systems out of compliance. So,
Right.
Yeah.
Okay. Are there any other questions or comments from the board? Alma?
No, I, at this point, have none.
Okay. Then are we, do we need to take, I guess we take a vote on this, yes?
The applicant want to speak.
Someone would make a motion, Jill.
Okay.
Jill, the homeowners are here. They may want to speak.
A quick question. If there's any chance in lieu of making a motion to deny, which it sounds like, if we could continue this conversation, I can have a conversation with the applicant on whether or not to withdraw or potentially reconfigure this to address the board's concerns.
So are you requesting a continuance of the hearing?
Correct.
Was that a correct? Is that, I couldn't hear that.
Yes.
Does Mr. Seidel want to add any comments tonight to this before we withdraw?
Yes, no, really appreciate the time of the board and the consideration of this. I guess one of the things that if we end up having to replace the system and end up putting the property on the market, if someone wants to put an addition on it or wants to put a new house, then a new system is going to have to be put onto another. It seems kind of wasteful to replace a system that then may have to get replaced again if someone adds a bedroom on the house or otherwise. But yeah, I guess that's not really because the system's working currently. It seems, but you know, I take your points about the fact that this is something that we're hoping to do, and so we're creating the situation. But you know, I think anyway, I appreciate the consideration. That was the only other thing that I had.
Mr. Seidel, I'm concerned that if you decrease the size of the lot on number 46, any potential buyer that wants to add on to the house physically takes up even more of the space. And if they want to add bedrooms, that's new construction, and that would have to be done in full conformance with Title V. And the less space they have to do that in, that may prohibit them from adding a bedroom, which, you know, might decrease the value of the property. So that's something you might want to think about if you're making the lot smaller.
Yeah, I think the lot is still obviously conforming. The new proposed lot is still conforming and still would support, I believe. I think there's plenty of space on the lot to do that, to do both. I think if someone were to buy it in the future and want to do that.
Well, the lot line would have to be conforming if you were going before the planning board for an A&R. They wouldn't let you create a non-conforming lot zoning wise.
And if you're concerned that a future owner might want to expand the septic system, you could always design a larger septic system than the number of bedrooms you currently have, assuming you can design it in conformance with the code. I mean, the incremental cost to design it for an extra bed, install a system for an extra bedroom is relatively small. So that's just another thought too.
Yeah, no, I think that's correct. I mean, unless there's a situation where they put a new house in and want to change the footprint,
Yep.
then the system, you know, would go with it.
Yep.
Okay, so are you then asking for a continuance for another discussion? You're going to come back to us. We're not voting on this currently then. Is that correct?
I believe that would be our preference.
Yes, Brian, we're gonna table it. We're not asking for the waivers.
Continuance, please.
Continuance, please.
Are you withdrawing this application, or are you asking for continuance of the hearing?
Well, how about a continuance, and I can get with my clients after this hearing, and if we need to formally withdraw, we'll certainly do so post haste.
Okay.
Okay. Okay. Well, thank you.
Motion to continue and set the date, Jill.
Okay, can I have a motion to continue this discussion at the at the next Board of Health meeting?
So I move to continue discussion at the next Board of Health meeting.
I'll
Okay.
second.
All in favor?
Aye.
Aye. Okay, so the motion to continue has passed. I believe it's October 18th is the next meeting.
13th. It's a Wednesday
Right.
Mhm.
because Susan will be on vacation. It's October 13th.
Yeah, 13th.
The 13th.
Which is a Wednesday. And Jill, don't forget, all votes have to be roll call.
Okay, so we had a motion to continue this at the next Board of Health meeting. Alma Healy,
I agree.
Mark Haddad,
Agree.
Deb Green,
I agree.
and I agree, Jill Block. Okay, thank you all for your time. Next, we're going to discuss a local upgrade approval for 282 Hayward Mill Road. Is somebody here from Doucette Engineering or Mount one?
Here he is.
Yep. Yeah, hi, Ted Doucette.
Hi there.
Hi. It's nice to meet everybody. I've been designing off and on in Concord since 2003, and I think this is the first time I've been before the Board of Health. We have what I feel is a pretty straightforward request here. If you want me to share screen, I can show a little bit of information, or I can just describe it for you.
I think you can just describe this one.
Okay, all right. So this is out in West Concord Center. It's a neighborhood that is known to be all sand and low groundwater. I've done about 3 systems out in this area, and that's what we found. What happened on this property is that we had the machine that was digging the holes, the hole just kept collapsing in because it was so much sand. Other places you've seen it kind of hold up, but in this one, it was just collapsing in. So we couldn't dig as deep as we wanted to, which we are now showing less than 5 feet of groundwater offset. It's between 4 and 5. It is a less than 2 minute per inch soil. So we're supposed to have 5 feet, but we have greater than 4. I'm really confident that we're going to have more than 5 feet. This house is up off the street, and it's kind of on a knoll. When you're standing in the backyard, it drops off steeply to the neighbor and it drops off to the street. So I'm sure that groundwater we're going to have, 7-8 feet of groundwater offset. But because we couldn't actually show it, I feel that this is kind of a formality that we're asking for this because I'm confident that we have the 5 feet of groundwater offset. So we are requesting 2 local upgrade approvals, and one is to reduce the groundwater offset from not less than 4 feet, but greater than the groundwater offset of not more than 1 feet, so that we are greater than 4 feet, but less than 5 feet above the existing seasonal high groundwater elevation. And because of the topography, the hill kind of still continues to slope up as we move away from the house. So it's getting deeper. So we're asking for greater than 3 foot, but less than 4 feet of cover over the system. We're going to vent the system, and the manufacturer certifies that the chambers are suitable to be installed that deep in a bed configuration. A lot of numbers. If you need me to repeat anything, if I confused you, please let me know. I'll open up to you for questions right now.
Susan, do you have any comments on this one?
No, other than it seems, I agree with what Ted's saying about the depth to groundwater really is unknown because of the problems with digging the hole in the sand. So he probably does really have 5 feet, but he's doing the right thing by asking for the variance because he can only show 4 on paper. And other than that, it's a straightforward local upgrade approval. I think, I like systems that flow by gravity just because they don't involve pumps that don't work when you don't have electricity. So I think it's always better to have them flow by gravity if they can. So I would recommend approval.
And this one flows by gravity, and you said it's because it's on this knoll, it's even better.
Yeah.
Are there any questions from the board?
No.
No.
Okay. Do I have a motion for approval on this one? To approve the local upgrade?
I'll move to approve the variance.
And a second?
Second.
And roll call vote, Alma Healy,
I agree.
Deborah Green,
Approve.
and Mark Haddad,
I approve.
and Jill Block, I approve. Okay. So thank you.
Okay, thank you very much for your time.
Okay, thank you. Okay, is there something I need to say?
No, I just said, all right.
Okay, great. For all of you in the audience, this is my first meeting that I'm chairing, so Karen is going to prompt me if I am missing a step here. Moving on to agenda item 3, which are polystyrene waivers. We've had 2 requests. And first, I'd like to hear from Kelly Shepard from Emerson Hospital.
Hi, can you hear me?
We can.
All right. So I'm back to talking about the 2 lids that I had from 2019, probably was. And unfortunately, I still have those same 2 lids because with all the production and manufacturing issues over the past 2 years from COVID, we have not been able to get a lid to replace the lids for these bowls that we use for our psych unit. We're lucky we get products on a daily basis right now as it is from production and manufacturing issues, and they are not focusing on making replacements for these lids currently. We're lucky we get these ones. So I still have these lids and the smaller one. And unfortunately, I cannot find a replacement for them right now. Maybe in another year, when they can focus on it better, I'll be able to find something. So
Yeah, I would hope.
I would hope too.
Right. Any questions for Kelly?
No.
Right. Do I have a motion to approve this waiver request?
I move to approve the waiver.
I second it.
Okay. I'll go backwards this time. Mark Haddad, how do you vote?
I approve.
Okay. Deb
I approve.
and Alma,
I approve.
and I do as well, Jill. Okay, thank you. And then we need to hear from Sanford Wong at New England Deaconess Association with your request. I thought I saw you here earlier.
I am here. Good evening to everyone. I too am having the same problems as Kelly Shepherd. For our long-term care facility, we still have 42 beds. However, 42 beds, we have a lot of the Dynex bowls that we use. There's like 4 items that we are still using the polystyrene lids. What we're trying to do is change it out to all ceramic, real china. However, the problem with that is we keep continuing with the tray service because of all the issues we've been having for the past year and a half. So with that said, we're still using polystyrene. And in fact, 2 of the lids that we were using are being discontinued. So I'm gonna have to use saran wrap very shortly. So we're doing our best and we're trying to find replacements, but I think the only way we could do this is really at some point replace all our equipment and just look for something that's safer to use. But right now, I'm asking for a waiver for these 4 items.
And it looks like some of them are the same items between the 2 facilities. It's both the Dynex flat lids for the bowls. So that's it looks like. So I'm surprised there aren't more users clamoring for this around the country. You'd hope. No. Any questions for Mr. Wong?
No.
Okay. Do I have a motion to approve this request then?
Jill, I see that Scott Richardson has raised his hand, so maybe open it to public comment.
Sure. Mr. Richardson, do you want to add something here, please?
Yeah, hi, thanks. Scott Richardson, 26 Yeltsin Street. Just would be interested in having the board ask the applicants what work they've done, how much time they've spent, how many suppliers they've asked. I understand that their existing suppliers are having trouble, but if we're going to make exceptions to this bylaw that was adopted by the town meeting and unanimously, darn near unanimously, we have a tremendous range of retailers and institutions in the town that have not asked for exceptions. So if we're going to grant exceptions, I think we need to understand a little bit more about the level of effort that people have put into it. Thank you.
Well, can I just weigh in? I know from my experience at Emerson Hospital, it's tremendously challenging to have keep patients safe from contamination with COVID. I mean, we have individually wrapped forks and knives and spoons for people just so they don't have any cross contamination picking up a fork. So I think these are kind of difficult times right now in the past year and a half. I think a lot of industries are finding supply chains being disrupted. I would expect when things improve from COVID that we're going to see better products available. So I don't think that the board is blowing off, anyone's blowing off the desire to be more sustainable. But I think, we have to recognize what our healthcare facilities have been going through in the past, year and a half, 2 months, 18 months.
And I would add that both of these applicants have come before the Board of Health before for waiver requests. They have gone through this and diligently over the years to try to find alternatives. And I know that there are communications provided that support some of the efforts to find alternatives. And so if it seemed like we were rushing through that, it was partly because we have been down this road before. And I know that they take this seriously because they've also reduced some of the other product requests that have come in over the years.
Can I say something?
Please.
And originally my list was about 6 or 7 items long, and over the years it's gone down to 2.
Right.
And things
We
that
know,
you put,
yeah.
things you put on a hospital tray for patients are very different than something that you would put out at a convenience store or put out at a restaurant. So those products that you use very different items than you would use in a different kind of food environment. So I have to look for different products. So.
Right, and when we've had these similar discussions at other years' meetings, when this has come up, we have had a number of different commercial establishments in front of us. So it does seem like it's winnowed down to the healthcare setting where, things are have different conditions.
Yeah, we have very few waivers now. So
Yeah.
I think that's progress since the original motion was passed in the town.
That's right. That's right. Okay. So do I have a motion to approve the waiver request from New England Deaconess Association?
I would move to approve the waiver request from Deaconess.
Okay, and is there a second?
I would second that also.
Okay, thank you, Alma. And roll call, Mark Haddad.
I approve.
I'm Deb Green.
I approve.
Alma Healy.
I approve.
And Jill Block, I approve. Okay, thank you all. Okay, moving on, we're going to have a discussion on COVID-19 now. First, we're going to get an update on from Susan on what's going on in the school. Well, Susan, why don't you start with an update and we'll go from there.
Susan, you muted yourself.
Here we go. We'll start with the most recent case counts from our public health nurse, Tricia McGeen. This is everything July 1st through September 15th. You'll see that this is both all of Concord, Carlisle, and Lincoln because she does all 3 towns. So you can see that we're having a number of cases in the 6 to 11-year-old and quite a few cases in the 16 to 20s and the 21 to 30s, which are people that can be vaccinated. Another thing that concerns us is many people that are vaccinated are becoming ill with breakthrough cases, and that's disturbing.
Susan,
Although
excuse me, Susan, your screen is showing your list. You need
No.
to open.
Is it showing the Tricia's case count?
No.
No, you need to open the PDF.
You are, it's not I did. Okay, let's try this again. Sorry, I thought you were seeing what I was seeing. Are you seeing it now?
No.
No. Okay, let me drag it out onto, hang on. Stop sharing that.
No,
Stop
Wrong
sharing.
one.
Oh, okay, try this. Now are you seeing it?
Mm-mm.
No.
It's-
Stop sharing that. How about now?
There you go.
All right. Sorry about that. Okay, so these are the case counts for Concord, Carlisle, and Lincoln. You can see the age group breakdown, and you can see, you know, we're seeing it in many age groups, and we are seeing a number of people who are vaccinated and getting breakthrough cases, which concerns Tricia and I. So Tricia updates this. We've had 14 cases in the last 7 days as of September 15th, which is the last time she put this together. So that's where the cases are. And then if I can stop sharing that and share something else. Try to share the DPH dashboard. Can you see that?
Nope.
Not yet.
Okay, that's a little frustrating. Locked because it's being used. Okay, well, what are we gonna do about that?
Can you drag it like you did the other?
I'm gonna stop sharing. How about that?
There you go.
There we go. Okay. So here's the dashboard as of September 15th. You can see the cases go up, the confirmed cases during the last 2 weeks. You know, you can see that a lot of them are in the 20 to 29-year-old range. That's the data down at the bottom. And the 30 to 39-year-old range, because those are the people that are socializing in close quarters, I believe. This just sort of is the data for various parameters since February of 2020 through present, and you can see the case numbers have gone up from June to October as we've seen the Delta variant emerge, and you can see the hospitalizations going up. So, you know, this is all the Delta stuff, Delta variant stuff that we've been seeing since July, which is, as you know, of concern. These are the confirmed and probables from last January through present, and sort of the counties broken down, and Middlesex County in general has a pretty high rate of new confirmed cases, and these are just this is just the cluster data. So you can see most clusters, most cases are happening in households, some in childcare, a number in social gatherings, organized athletics, long-term care facilities, kind of the places we would expect close contact. And then Jill asked me to put together the Concord data. Concord looks better than many of the towns in the area. Our test positivity rate is 1.37, below the state average of 2.15. So that's looking pretty good. Our average daily incidence rate is 9.2 compared to many of the other towns in Middlesex County. So we're looking good compared to those. Here's our percent positivity. We're at about 1%, as I said. Again, that's low for the rest of Middlesex County. So we feel good about that, even though we're seeing cases. And the case count for the last 2 weeks says 24, which doesn't match up with Tricia's data, but that doesn't surprise me because they're not the same dates that we're looking at. So, you know, it's kind of a moving target from week to week. So we are seeing cases in the schools since the schools opened up, but Lori Hunter assures me that she's quite confident there's no transmission of disease within the schools. The kids that are getting the cases are, we're fairly certain are getting it from what they're doing outside of school, which is reassuring.
Right.
So that's kind of the update. And then, you know, we had On September 2nd, we had issued the news and notices to the town with the strong recommendation that people wear face coverings when indoors. And that kind of leaves us at the discussion of whether the board wants to think about a face covering order similar to what the surrounding towns have done.
I would say some of the surrounding towns.
Some of the surrounding towns.
Not all towns have, and what I find interesting is that even without that mandate in place, we have been holding steady, it looks like.
Right.
And that it's not, we're not increasing in great numbers anywhere. When I dug into that data, it looked like the 14-day incidence rate was actually on the decline. And it also looks like hospitalizations are going down as well. Deb, I'm curious what you're seeing in the hospital, if anything, these days, whether you're seeing any changes at Emerson.
We're seeing some COVID patients, but there's not a lot of hospitalizations. I think there's maybe 5 in the hospital, so it's not. It's definitely not January 2021. So, and mostly I would say unvaccinated people.
Right. I think the good news today is that, the news about vaccines for children, ages 5 to 11, and, it looks, it's all preliminary now, but it sounds like they want to start, that it's likely that the FDA approval will happen before Thanksgiving. And I think that will certainly benefit the community as well as that happens. There aren't that many cases in children. It looks like there's been a total of currently there's only 3 active cases on this data. So I think that, masks in schools seem to be really working. I think the schools have done a really great job of putting in those protocols and checking in every 2 weeks to really monitor this and make sure that what is in place is working well. So I'm hoping that people learn. What I've observed anecdotally is even without a mandate, when you go into stores, it seems, or any, in shops, I haven't been in restaurants personally, but when I'm in stores, I'm seeing almost everybody masked without a mandate in place. So, and these numbers seem to just be holding steady and not going up. People seem to be doing the right thing, but I would like to hear from other community members about this and how you're feeling about the need for a mask mandate or not having a mask mandate. If there are members of the public that want to speak about this, actually, Susan, if you can stop sharing your screen, that'll help. Thank you. If people want to comment about whether or not you feel like there's a need to put a mandate in place, I would like to hear from you. And as I said in the introduction, you will need to state your name and your address, so you can be entered into the public record.
You can raise your hand.
Yeah, and Karen, will you be calling on people for us?
I can see people, yes. So there's Mr. William Sabine or Sabai. William Sabai. Up, you have to unmute. Let's see.
Or can you do that?
I can, but I get.
Thank you so much, Karen. Melita Teichert.
Oh, hi, Melita.
Hey, hi. Nice to see you in person by Zoom.
Well.
Yeah, Melita Teichert, 124 Sandy Pond Road, on my husband William Sabine's computer. This has been such an interesting meeting. I appreciate everyone's work. I'm coming at this looking at the new Delta variant, looking at the breakthrough cases, thinking of the risk as a community and individuals, especially young people, the immunocompromised and the elders. To me, a mandate is really a common sense or sensible approach, consistent with many of our sister communities. I mean, you name it, Bedford, Carlisle, Lexington, Lincoln, Sudbury have done this. And to me, when I think about the need, I have had a different experience in the community. What I have found is even in essential services like grocery stores, it's very inconsistent. So while your strong advice in that fine letter of September 3rd, I thought was powerful, what I'm finding and speaking to friends in the community, others are finding is very inconsistent. So there are grocery stores in town, for example, where employees are not masked. And it is very disconcerting having an unmasked employee, cut meat at the deli or handle produce or checking you out. You're masked. You hope the elderly woman ahead of you, her mask isn't slipping, because it just takes someone sneezing who doesn't even know they have the disease to spread it. And it really bothers me to see that, but that does exist in our town. I mean, similarly, there are grocery stores. That's the one place, I'm not indoor dining either, but the one place I am frequenting. Some of the stores, you see employees masked consistently, but the public very inconsistent. And for someone with a family member at high risk, which I do have, it makes me much less likely to shop. Were there a mandate, I would feel it'd be much more predictable. I would be inclined to go out more and to shop in stores more, because I would know there's this extra layer of protection, which is conforming with, the CDC's wonderful guidelines. Hey, whatever your vaccination status, please mask indoors. So to me, it's a sensible guideline. I have one little thing I'm going to read here, which just is a personal comment. To me, masking is actually one of the kindest, easiest, and most neighborly actions we each can take to help keep our fellow citizens safe and ourselves safe. But sometimes just strong encouragement from the town isn't enough. And I think, again, to have a consistent, uniform guideline that puts public health first, a mandate is in order. So thank you so much.
Thank you.
Are there any other people that wish to speak about this?
Don't see anybody else's hand up.
There's Carol.
Carol
Carol?
Wayland.
Okay, Carol. She didn't have her hand up, but.
Yes, thank you for letting me speak. I'm Carol Wayland, 6 Abbott Lane, apartment 6. I'm executive director of the Performing Arts Center of 51 Walden. As many of you may know, it's a community performing arts center and is home to the Concord Players, the Concord Band, the Concord Orchestra, and Opera 51. We have been very careful about using the facilities since March of 2020. We have installed UVC units in the main hall, which is a ultraviolet ray which disinfects the air. We use ceiling fans in the lobby and in the hall. And we also have powerful exhaust fans above the drama stage so that when windows and doors are open, there's quite a draft through the building. We have had several rehearsals of all of the groups in small ensembles, widely spaced in the hall, masked when possible. And we have had several small performances, and we require that all audience members be masked. All performers, actors, musicians have been vaccinated. So we are hopeful to resume performances this fall and are happy to take any more measures that the Board of Health might suggest to keep everyone safe, which of course is of paramount importance to us.
Thank you for that comment. Do you require people to wear masks now? People coming into the building, are you asking them to?
Yes. If anybody would object to that for any reason, we would just refund their money and say, you know, this is our policy inside the building.
Mm-hmm. Thank you. Any other comments from the public?
Yeah.
Lois Whitney.
Lois Whitney, I see your hand, but there's a way to raise your hand, folks. I can see easier if you, in the reactions, if you put your hand up, I'll be able to see it. There you go, Lois.
Okay, thank you. Lois Whitney, 178 Heathbridge Road. I am following the arts very closely and want to call to this group's attention that in the Boston Globe, I read the Umbrella Stage Company is about to do in-person performances starting the 24th of September. And they are requiring masks and requiring a validation that you have been vaccinated or a negative test. So that's upping the ante another step. And I just wanted to put that out there. I have also been to a local grocery store where the shoppers are masked, but not all the employees. And I am wary of whether I want to go back there. Quite frankly, I have a household member who's high risk. I'm not as young as I used to be. So I would encourage Concord to join the surrounding towns who have also made a mandate. I know not every town has, but I'd like this town to step up and join those for the safety and health of the public. Thank you.
Thank you.
So Ms. Whitney, what you're saying is that you don't feel safe wearing a mask. You don't feel that's enough to protect you from transmission of COVID. Is that correct?
In view of the variant and people out there who don't realize that they are carriers, that is correct. A mask is certainly helpful, but there is that Delta variant that we all keep hearing about. And asymptomatic carriers.
Mm-hmm.
I was actually,
you should be safe if you're wearing a mask and taking precautions and staying 6 feet away from people and washing your hands, right? I mean, you should be safe, right?
well, that's all very helpful. But not everybody is doing that.
Yeah.
Employees, you can check out. While I was there were a few people in one store. And so one person was unmasked, one was masked. And I asked if I could go over to the 12 items or less store. They were not busy. And I have had to do that twice. And then when I was leaving the store, a younger person was coming in unmasked. We certainly weren't 6 feet apart. I just think it's a simple courtesy, a step that we all could take to help each other.
I mean, I think it would be courteous. It would be nice if everyone followed the CDC guidelines. I think, though, that the problem is that it's an incredibly controversial issue right now, masks. I mean, I think there's probably a lot of people like yourself that want masks, but I think there's a lot of other people that are just going to be vehemently opposed to it and probably flood our mailbox and inboxes with opposing comments. So I think it's a challenging thing. It would be nice if everyone followed the CDC guidelines, but it's hard.
Well, I guess I would come back to the surrounding towns that have made a mandate. And I feel like, where's Concord? I actually grew up here. I've been here quite a while, not all the time, but I did come back with my family in later years. And I'm sort of saying to myself, where's Concord? We would not be unique if we choose to make a mandate. So thank you for listening. I appreciate it.
So one of my questions, and I'll get back to I see people have their hands up, but there's nothing that prevents any of the stores from requiring masks to enter. So we don't need to do this mandate to prevent, stores can go ahead and require it and any business can choose to do that without our work.
And some have.
And some
There's
have.
many businesses that have.
And one of the, and, you know, and with the numbers that Susan presented in the, you know, beginning reflect the period of time that Concord has had this strong advisory that we put out. And we've not seen an increase in numbers over that time. If anything, there's been a decrease in numbers. And I'm optimistic that with more children getting vaccinated, that numbers will continue to go down. I'm hopeful. And so one of the questions that I have is, if there's a mask mandate, will the numbers really be any different? And my understanding of public health tells me that I don't really think it's going to change much within this community, honestly. But that said, I do want to hear from Virginia Lang, who I saw had her hand up for a bit. So,
Hello, I'm Virginia Lang. I live at 15 Concord Green, Unit 4. And I would like to also state that I think it would be wise for Concord to have a town mandate. I have had the same experience as other speakers have of going into stores where most of the people are masked and the help are not always masked. Some are and some aren't. And it seems to me that Concord should step up to the plate and not worry about people who don't like, you know, I know it's a very controversial subject, the masking, and it's turned very political, unfortunately, but I don't see why Concord has to hold back. I think it would be helpful. I'm an older member of the community, and the Delta variant, frankly, I think is an unknown and is very scary. And I've been very careful not to go out in groups. My church is open, but I only go out to the outdoor coffee hour after watching the service on Zoom. So I would just like to add those comments. Thank you.
Thank you.
Stephen Bader was next.
Hi, Stephen Bader, 7 River Street. Is there some medium ground where, if you say a mandate, that presumes that there's enforcement or a penalty for violating the mandate? I'm wondering if something just short of a mandate, like a statement to the effect of the Board of Health of Concord expects you to wear a mask indoors, period, full stop. I think that sets a tone without getting into the debate of, is it a mandate, isn't it a mandate, who cares? You want to get people to be safe, just say, we expect you to wear a mask.
Thank you for that, and for also raising the issue of enforcement, because that is one of the biggest challenges with something like this. Who does enforcement fall upon? It's our health department staff, who really have very limited capacity and can't necessarily. Who else is there? The police. We could deputize them. We did in the very beginning, but they're not necessarily taking on that responsibility either. So it does become one of those challenges where, what do we do with it?
Mm-hmm. I mean, I guess I would add in what is the end point here? I mean, I just question, if we have a mask mandate, what is the point in time which we will reverse the mask mandate? Is it, you know, we've had how many cases in the past 7 days? 14, Susan? You know, what do we have a mask mandate until we have less than 10 cases a week, less than 5 cases a week? Like, what's the end point? Because I think if you're going to put something in place, you need to have a plan for the end of the mandate. And I mean, I think Concord's doing a pretty good job. You know, we went out and got vaccinated. We have a high vaccination rate. I certainly think that the stores and the businesses have the right to post mask mandates themselves. The problem is it's just completely unenforceable if we put a mandate in place. So I think if we were going to put a mandate in, I think we would need to really carefully think about what our goal is. I mean, to lower the transmission even more. I'm not, you know, I'm not sure there's a measurable endpoint at this point.
I could add something to that, Dr. Green, which is a lot of the cases that Tricia is seeing in the younger people seem to be resulting from young people socializing, as young
Yeah,
people are
of
known
course.
to do.
Yeah, of course.
My other concern is most of the people that have spoken to this have spoken to the retail store situation, but we have many office buildings in Concord where Board of Health staff doesn't typically go. We could really only enforce it there upon complaint from another employee. And then, you have to catch some, I hate to use the word catch, but find somebody not wearing a mask when we go. And, we're not a SWAT team. If somebody calls us, we're not out there 10 minutes later. So those are my concerns with enforcement.
Yeah. Because it's an impossible task, and it's impossible to enforce.
I see another hand raised.
Nina, who's Nina? Or Nina, I can't, you're muted, let's see.
And she disappeared from my screen.
No, she was unmuted, now she's muted again.
Okay. Is
There
it-
you go.
Can you hear me?
We can, thank you.
Okay. My name is Nina Huber. I live at 83 Wright Road in Concord. Just a couple of comments, mostly a question. I see no reason not to support a mandate. I'm not concerned about enforcement. We have many, laws on the books, seatbelt laws, don't use your cell phone laws. The reality is that we live with these things not being enforced all the time. But the fact that it's a law, as opposed to what Stefan was saying about, a strong suggestion, the fact that it has been declared a mandate, you need to do this, is strong. But we don't have to worry about, oh my God, how are we going to enforce this? I don't think. I mean, the problem seems to be when store owners try to enforce it with people who blatantly don't obey it. My big question, though, is I heard someone say, didn't you feel safe enough going into the store wearing a mask? But my understanding is medically, the mask is much, much more effective at preventing an infected person from breathing out the particles than it is in protecting a user from those particles. Is that, and that would go toward reporting a mandate. Is that true? Or when we wear a mask, should we feel like, yes, we have a shield and nothing's going to happen? So you may not wear your mask, but I'm wearing mine, so I'm fine.
Well, I think it goes both ways. So I think if you're wearing a mask, you're protected and you're protecting others.
Equally? Goes that way equally?
I would say yes.
Okay. Thank you.
Okay, thank you. Are there any other public comments? Because I would like to hear from other board members how you're feeling about changing from our strongly worded encouragement to a mandate.
I would agree that a strongly worded document would be, I would go for that rather than a mandate, very definitely. And I love the fact that the Concord numbers are lessened in recent weeks, and that in itself is.
Alma froze.
Alma froze. She did.
Totally
It's
froze.
very encouraging.
Okay. You froze for a moment there, Alma.
So basically, I am saying I am not inclined to vote for a mandate. I love the fact that our Concord numbers are lessened greatly, and an enforcement with a letter from the Board of Health, it would be fine with me, but not a mandate.
Mark, do you have any thoughts on this?
Yeah, so I appreciate everyone's feedback. I think frankly, I could sort of go either way. But I think the reality is that, we have a pretty responsible community. People are generally respectful of their neighbors and sort of acting responsibly. And at least in my experience, I've seen plenty of masking. Certainly, at the very least, we should have, a reiteration of our strong encouragement. I also think that, there's a place for, if there are businesses that don't want to require masks, we don't have to frequent those businesses if we don't want to. And so I think there's a place for the market to sort of have, places that do a good job of compliance and some places that maybe aren't as compliant that you're not comfortable shopping at for that reason. And so to me, I think the big thing is, I think we should watch the numbers. I didn't see in the numbers anything that suggested that we're getting spread in these public places and grocery stores or things like that. And I think if we saw that, I would definitely be in favor of considering a mandate at that point. And I think we should be monitoring it closely, but I don't, at least on what's been presented, I don't see sort of a reason why, we have to do it. I think part of why our numbers are good is because people are doing it anyway, regardless of, mandate or no mandate. I would say though, also, I think to me, the schools is a very different situation because you've got, a lot of kids who can't be vaccinated. You've got them in close quarters, even with the 3-foot spacing for an entire school day. You've got them, together all day. I think I'm very much in favor of, the current policy at the schools of having masks in the schools. I think they're two different situations.
Right. I would agree with that the schools, that what they have in place is really important and it's been effective. And as we said earlier, that the transmission that's happening among kids seems to be happening outside of school. If it was in school, we would see much higher case numbers than we are, and we're not. Just so that people understand, the public understands, a lot of our surrounding towns do not have mandates in place. Acton does not have one, Maynard does not have one. Not every town is doing it, and we have better rates than some of those towns. And it's not a competition, it's not a race, but I do again see that the numbers are holding steady or going down in some cases with the work that we've done. And I think with the advent of vaccines for younger children, children under 12, I think we're gonna see greater improvement as well. At least that would be the hope. So among the board, I'm not hearing a strong desire for a mandate. Is that the case? So I'm wondering whether, just to keep this moving, we might want to just, as always, keep monitoring the situation very carefully. And then, revisit this. If numbers were to change anytime soon, I think we would, it sounds like we're in agreement that a mandate would make sense. I think that personally, I do see that people for the most part are doing the right thing, and it is a sign of kindness and respect. And Concord has a lot of that going on. So I would suggest that we keep watching this really carefully. I guess I wonder if there's a need for a motion to reissue the strong advisory, somewhat change the wording as suggested by Stefan Bader. Is there any desire to do something like that?
Yeah, I don't know if just a little bit take on, or a little bit of a PR change, just saying, look, follow CDC guidelines. You're supposed to wear a mask inside. Keep Concord's numbers low, something like that, to that effect. And kind of revisit this maybe every 2 weeks, just kind of keep an eye on the numbers and be ready to change at any point in time.
Right, we can always have an emergency meeting to discuss a mandate if there's a dramatic change in what we're observing right now.
So Jill, Tricia provides me with the numbers at least once a week. I'll continue to forward them to you. And, you know, to get back to the transmission within the schools, Tricia is intimately involved with every case in the schools and working with the nurse in that school, and the school nurses are aware. I mean, we will be on top of it if there is transmission in the schools. We will know. These are not just numbers to Tricia, these are people, and to the school nurses as well. But to loop back to something you and I had talked about earlier, school committee started the year requiring that everyone in school be masked regardless of vaccination status. And then DESE came out and mandated the same until October 1st, but DESE may rescind that October 1st. School committee is going to revisit the mandate every 2 weeks, and I think they would appreciate the board's support for their decision to require masking in the schools.
After October 1st, or?
Yes, well, and with the idea that they have made a commitment to revisit it every 2 weeks.
So does that mean that we write a letter stating our support for their continued requirements and monitoring, and even beyond October 1st? I mean, I'd say until children start getting vaccinated, and, you know, maybe 5 months into this or so, you know.
I mean, I would leave the decision up to them, but they will appreciate your support as they consider it in the same way that you are going to continue to consider it.
Yeah, I mean, I certainly support that. I view the schools as a very different situation because, you know, there is no different alternative for education for children. And so, right. So to me, if there's a store that's not doing a good job of having its own mask policy or having workers not complying, we can all choose to not frequent that store and go to a different store. But the schools are the schools. We need kids to feel like it's safe to be there. So I'm fully in support of the school committee's, you know, continued mask mandate in the schools.
And it's for the faculty and the staff as well. You know, it's really important there. Yeah. So do we need a motion to revisit this with frequent monitoring and offering our support to the school, the board, the school department, Concord Public School?
Susan, I'm confused. Is the board writing a letter of support, or did Lori Hunter already write that letter to school committee?
I don't think she's looking for a letter of support. I just think if I can communicate to her that the board is supportive of what school committee is doing and endorses what school committee is doing, I think both Lori Hunter and school committee would appreciate that.
So you can make a motion to do that. It'll be in the public record, and then we could just forward that to her.
Yeah, Jill, I think we should do this as separate items. So I think one motion is about
mask mandate.
The mask mandate. And so I think, to summarize what I heard, I would make a motion that we continue to monitor the situation and consider whether or not to have a mask mandate in the future. But for now, we're going to reiterate the letter that we've previously issued, maybe with some messaging and wording changes in it, and strongly encourage all Concord residents to wear masks in public settings. So that would be the first motion.
Okay.
I second that.
Okay. And all in favor, Alma?
I agree.
Yeah.
I agree.
Mark?
I agree. I approve.
And I agree. I approve. Okay, so we'll get that drafted. And then for the schools, the second motion.
Yeah, so for the second, so I would move that the Concord Board of Health is in support of the Concord School Committee's current policies on mask mandates in schools and their, you know, continued monitoring of and consideration of the situation.
I second that.
Okay, thank you. Okay, and I am in agreement with that. And Alma?
I also agree with that.
Mark?
I approve.
And Deb?
I approve.
Okay.
Mhm.
All right. Thank you for that, and thank you for all of the public that joined in with your thoughts on that one. And we watch that closely. I am one of those data people that sits there looking at that state data for fun on a daily basis. It gets refreshed by 5 o'clock every day. So I take that seriously. Okay, so moving on to item number 5. We have a request to be heard from Deborah Stark on an opportunity to discuss the use of refillable containers in accordance with the Massachusetts Food Code 105 CMR 590.000. Deborah, I open the floor to you.
Thank you very much. So hello, everyone. I'm sorry that I'm keeping you here later, but tonight I want to talk about reducing our consumption of single-use plastics by allowing people to bring containers from home. And as we all know, those are called returnables to fill with bulk foods. And I'll be turning part of my 15 allotted minutes over to town citizen Janet Rothrock at the end. So she'll speak more intelligently than I am sure. But part of the town's mandate is to reduce and reuse and to send less waste to landfills. Returnables, I believe, can play a pivotal role in making that happen. And bringing containers from home can also reduce the use of new plastic. But returnables, it turns out, are against the law in Massachusetts with one exception that I'll get to. And the issue is cross-contamination. But it is my belief that cross-contamination pales against the greater risk of plastic to the health of the ecosystem and to human health. I'd like to reference only one study from 2019, and the study was called Plastic and Health, the Hidden Cost of a Plastic Planet. And it was written by a consortium of nonprofits led by the Center for International Environmental Law. I also sent Susan Rass, thank you, Susan, for a graphic handout that depicts the health hazards of plastics, which I think the board should have in your packets. That study said in 2019 that every minute, 1 million plastic bottles are purchased and 2 million plastic bags are used. We know that plastic and its smaller particles called microplastics never go away. They don't degrade, and they're found even in remote corners of the world and in animals and human beings alike. The study says, and I'll quote, "They enter the human body via direct exposures through ingestion or inhalation and are linked to an array of negative health outcomes, including cancer, cardiovascular diseases, inflammatory bowel disease, diabetes, rheumatoid arthritis, chronic inflammation, autoimmune conditions, neurodegenerative diseases, and stroke." I think we all know that the science of plastic and how it affects us is in its infancy. It's not a mature science at all. But my question is, are we willing to be guinea pigs? Are we willing to wait until the studies and the science confirm that we're poisoning the planet and making humans unhealthier, more susceptible to disease? I think even with the limited data that is available today, the health impacts of plastics throughout its life cycle are overwhelming. So I really thought it's a no-brainer. I thought we educate people. We ask them to bring in, take a step in the right direction by encouraging them to reuse containers they have at home, whether they be glass or stainless or used plastic even, to fill with bulk foods. I really thought that was low-hanging fruit, just like we all went to LED light bulbs. But I learned from Susan and Gabby that the state of Massachusetts does not allow the refilling of containers from home with any foodstuffs. Our state interpreted the FDA Model Food Code, and I won't quote the number now, but I have it, differently than other states. The Model Food Code, according to my conversation with Thomas Neary of the FDA, said that it specifically refers to hot food served at restaurants and that it's not a regulation. He said that it's a summary of findings arrived at by scientists, academia, the FDA, and other interested parties to protect the public health at a moment in time. Our state took the model food code and expanded it as the food code, which you have 105 CMR 590, to prohibit the use of refillable containers for bulk food shopping unless, and here's the exception, unless the consumer can prove that they bought it from us, that when they return, we take it from them, we visually inspect it, we wash it, we sanitize it, and we dry it. And can you imagine any retailer having the staff or the resources to do that? Can you imagine what a deterrent this practice is to the consumer, how inconvenient, and what a waste of water and other resources, and what happens to all the containers we already have at home? And cross-contamination, I haven't read cases in the newspaper of illness or death due to people refilling home containers. I haven't read that other states are having an issue or having a problem. And we know that some towns in this state are allowing returnables and their boards of health are looking the other way. We don't want our Board of Health to have to break the law and look the other way. And I want to make that really clear because I appreciate what they do for us. But in the last 30 years, our store, Deborah's Natural Gourmet, has not had one case of illness or death by returnables. And I've been using my mom's old glass jars and filling them with lentils and sesame seeds for years. I've been bringing in a cloth bag and putting onions and oranges in them, etc. So we're really not asking the department to mandate risk for any citizen. We're simply asking that the department create a framework for citizens to make their own informed choices. I really respectfully submit that it should be easy for people to make the choice to fill their containers from home with bulk foods as one way to reduce and reuse. And those who aren't comfortable with that concept can continue to buy packaged goods. Along those lines, we don't prohibit the use of paper or canvas shopping bags from home. We don't legislate pet owners who come in covered with pet hair, or people who swing their long hair that falls out in our shop, or those who scratch, or those who come in and blow their noses and sometimes drop their Kleenex on the floor. We don't ask people when they've last bathed. So, and I just realized, I think I left out a whole page here. I left out a whole page about this, what we have done in our town, and we know that the town's mandate is to reduce and reuse. So I won't go back to that, but we know that the town in town meeting 2017 and 2018 did establish a mandate to reduce the amount of waste that goes to landfills and to reuse and reduce. And they said reduce, reuse, and recycle in that order, exclamation point. So our ask is, we believe that the Food Code 105 CMR 590 is out of date. Its guidance is actually harmful. So we want to ask the Board of Health to be proactive, to lead, to ask the state reinterpret and rewrite, to bring it up into the modern era. We want the Board of Health to find a way to allow returnables today while until the change happens at the state level. And according to John Fisher at the Mass Department of Environmental Protection, they are in conversation with the Massachusetts Department of Public Health. But change, John says, is slow, and he expects those conversations to have results maybe in 3 to 4 years. And my question is, can our ecosystem and can our citizens wait that long? So I want us to remember that Concord was the first town in the country to ban single-service plastic water bottles. That was such a big achievement on our part. And returnables are an important next step. And if we don't take that step, it doesn't bode well for the work ahead, because there is so much we need to do to protect human health. So with that, I'm going to stop. And I think I did that lickety split. And I'm going to turn this over to Janet Rothrock. Thank you, everyone.
Thank you.
Hi, I am Janet. I am not David Lebling. And Susan Rask, you sent an email yesterday saying I should make my comments during the public comment period.
I think it's fine.
That's up to the chair.
Yeah.
Please, you can go ahead and proceed.
Okay. I'm using my husband's computer because mine's flaky. Okay. First of all, I want to start out by saying I have a background in science. I have a master's in public health. With a concentration in epidemiology. I interned at the Childhood Lead Poisoning Prevention Program and was a project manager at Harvard School of Public Health and a researcher for the Division of Dental Health at the Massachusetts Department of Public Health. So I come at this from a science background. And I wrote this statement with a lot of input from Alice Kaufman, who was a former select board liaison to the Board of Health. Oh my goodness, what happened? Oh, can you hear me?
Yes, we can hear you, but it looks like Paul Gill started sharing your screen. So Paul, please, if you can close that out.
Okay, whatever. Anyway, I talked to a number of people and my comments reflect those of many other people, I think, who are on this call, including Concord's Comprehensive Sustainability and Energy Committee. So I'm here tonight to ask about a change in the public health requirements that prohibits customers from bringing their own containers to fill with bulk food items. I can recall when I could come in with a mason jar to fill it with beans or rice or something like that at Deborah's, but I can't do that. And I'm wondering if you can tell me or can find out what caused that change. Alice and I looked at the model food code and we don't see anything that directly prohibits consumers from using their own containers. Some other communities allow consumers to bring in their own containers, and I don't understand why Concord should be different. I've also noticed that there are inconsistencies in how different foods are dealt with. For instance, I can bring my own coffee mug to a coffee shop and refill it myself, which is expressly permitted in FDA Model Food Code 3-304.17 paren D. Then I looked at APP, which is the Administrative Policy and Procedures document number 60, which some of you may remember from 2011, which are Concord's Sustainable Municipal Practices. It was approved by the Board of Selectmen in 2011, and it gives 4 sustainability principles. Reduce dependence upon fossil fuels, underground metals, and minerals. Second, reduce dependence upon synthetic chemicals and other manufactured substances. 3, reduce encroachment upon nature. And 4, meet human needs fairly and efficiently. And it goes on. Language in the full APP 60 states that in furtherance of this policy, town departments, managers, and staff, and town boards and committees shall, 1, include cumulative and long-term impacts on sustainability and decision-making. 2, prevent additional pollution through planned proactive measures rather than only corrective action. 3, support and implement innovative programs that maintain Concord's leadership as a sustainable town. And 4, facilitate citizen participation in policy decisions involving sustainable practices and encourage everyone to take responsibility for their actions that otherwise adversely impact the environment. I also noted that the sustainability principles were referred to in recent town meeting votes, banning retail sales of single-serve PET water bottles, thin film plastic bags, and polystyrene foodware. Concord is serious about its sustainability. So I'm asking the board also to review its policies with regards to allowing customers to bring their own containers to groceries and other stores, and to revise the policies to allow those of us who would like to decrease throwaway packaging and adhere to our environmental values to do so by bringing clean containers from home. This request is in effect an allowance, not a prohibition, so those who want to use their own containers can, and those who don't want to don't have to. I'm also asking the Board of Health to ask the Massachusetts Department of Public Health to confer with the Massachusetts Department of Environmental Management to come up with a solution that satisfies the goals of public health, both from a foodborne illness perspective and an interest in decreasing use of throwaway packaging, especially plastic packaging. The DEM has aggressive goals for limiting plastic pollution of the environment because plastic is a carcinogen and an endocrine disruptor, and increasingly we are consuming it in our food and drink. Environmental health is public health. So I appreciate your time and consideration, and I hope you'll consider any of the emails that are sent on this subject. Thank you. Oh, I forgot to tell you, I live at 618 in Nurse Neck Hill Road.
Thank you. So I'm hearing a couple of different things. I'm hearing that your ask to us is to put this request into DPH to talk to the Department of Environmental Protection, and that you're asking us to create a framework for citizens to make their own choices and to lead by asking the state, and to change now in advance of the state changing things. Is that right?
Basically, there are two asks. One is to tell us what changed, because before 2018, we could bring our own containers in and fill them. And after 2018, we couldn't. Well, you may, I see you shaking your head, but the practice was that was what was done, whether it was allowed or not. Okay, the other, so my question is, why was the practice different before? And similarly, why is the practice different in other towns and different with respect to coffee, for instance? So there are inconsistencies in the application of the food code. So I'm curious about the discrepancies, the inconsistencies. And the other thing is, because we are environmentally minded, it would be, and because our sustainability practices require the boards in the town and committees and so on to abide by the sustainability principles, can we find a way forward, probably the Department of Public Health in conjunction with the Department of Environmental Management, can we find a way forward to legally use our own containers here in Concord?
Susan, I want you to comment on the 2018 comment.
So it is true that in 2018, the Massachusetts Department of Health adopted the 2013 Federal Food Code. Prior to that, they had adopted the 1999 Food Code, which also did not allow people to bring food containers from home. So if it was in fact happening, we were unaware of it and we would not have allowed it. I feel I have to correct a few things that have been said here, which is the 2013 Federal Food Code is not a model code. It's not a recommendation. It's adopted by reference into 105 CMR 590, which is the Massachusetts Food Code, and it is the regulation we enforce. It's not a recommendation. It's not a model. It's not an interpretation. The language in it is explicit. And that's what every food establishment their license is granted. They state they'll comply with the food code, and we enforce all aspects of the food code when we do food service inspections. So, and we try to do it fairly and consistently with every business in town.
Right. Thank you. Okay. One question I have is that, you're asking us to take some steps because it's a slow process to work in the state. So you see us as an opportunity, or you see the board as an opportunity to pursue this. And I am in agreement that, we need to reduce and reuse. And with that, what I'm struck by is when I go into stores such as Deborah's, that there is a tremendous amount of single-use plastic being used in takeout foods. Takeout food containers are all single-use, and there's individually wrapped sandwiches, there's individually wrapped hard-boiled eggs, there's individual smoothies, and they're all in single-use plastics. So Deborah, I'm just actually wondering if your plans for, as you extend your kitchen and the new facility, how you, if you're thinking about how you're going to address all of that other plastic use at the same time.
We are thinking about that. Can I just answer? Beverages are exempt. I know Janet asked about coffee cups going into the Starbucks, and beverages are exempt because the beverage lobby was very powerful and very strong.
Mm-hmm.
And according to a consultant we work with, and according to Thomas Neary of the FDA, the federal code was a recommendation and wasn't, so maybe I don't understand the law, Susan, but that's what those people told me. And plastic is, I mean, it's a terrible issue. It breaks my heart when I look at our kitchen every single day. And yes, we are thinking about that. And yes, we keep interviewing people. Right now, our choices for the kitchen seem to be using GMO, plastics made from genetically modified corn, or, we don't have those good choices. They aren't really available yet. And the FDA code does at present prohibit, putting food from kitchens, restaurant kitchens, hot food into containers from home. So there are a number of things, but this seemed like such low-hanging fruit. It seemed like a great way to start, to make a step in the right direction. So that's our purpose. And yes, we are looking into doing things differently in our kitchen as time goes by, as supplies become available. Right now, we are putting soups, for instance, in paper, cardboard containers instead of in plastic. But if somebody had the solution, I'd love to hear it.
So, Susan and Jill, do we, I understand, I'm just trying to, it's a little disorganized. So I understand that we're being asked to write to the board, the State Department of Public Health, and ask people to start working on a change. I get that. But what do you mean by establish a framework? Like, is the Board of Health allowed to, Susan and Jill, is the Board of Health allowed to say, we understand what the state rules are, the state laws, whatever, can we say we're going to allow this business in Concord to use refillable returnables? Are we legally allowed to do that? Can we do what we want? Can the board do what we want?
Deborah could apply for variance from the food code to be allowed to, well, she would have to make the request, a specific request, what she's asking for specifically, which food products she wants to dispense into containers brought from home. And it would have to be done under the variance procedure that's in the food code, which is, I've got it right here, which is 8103 variances and the following sections. So she could submit a proposal to do it for specific foods, and you would have a hearing at which you would consider her proposal, and then you could grant it, partially grant it with conditions, whatever you might deem to be appropriate.
Is that what you're asking for, Ms. Stark?
That certainly is a wonderful recommendation, and we will be happy to do that. But we are not only asking just for ourselves. I mean, we would like Concord to really be a leader in seeing that returnables are allowed, because it's our firm belief that every day that we're not doing that, we're just encouraging more plastic, more single-use plastic to go into the waste stream and into our landfills.
Mm-hmm. I should have begun this section with just mention that this is, at this point, this is just an informal discussion so that we can all learn.
Right.
We're not taking any formal votes tonight or any formal action. If there is to be a request for a variance or any formal action, you will have to make that, and we will consider it again at the next meeting. So this is really the intent here, is to really start educating us and to hear from other people thoughts on the subject. So we're not prepared to take action tonight. But I would like to hear from others if you have additional comments that, haven't been expressed in other presentations. I would like to hear from you. And
Ellen Quackenbush has her hand up.
Yes, thank you very much. So maybe the people who know more about public health than I do can answer this question, which I think is pretty simple. Why I understand how hot foods, you might have an issue with bringing my own container to take, hot soup from some establishment, but lentils or beans or wild rice, I don't get what the contamination risk is. When it's gravity fed, it's going to go from the container where the orifice is smaller than the mason jar I'm using. I just, as a consumer, I don't get what the concern is. And frankly, I feel like it's a lot, I don't get it. And I also do not understand the public health rationale. When we're talking about COVID, I totally get it, but this seems like a lot, I don't know, I don't get it. And I'm concerned that it's nitpicking. And I just wish that the Board of Public Health would allow consumers to do something to me that is very low risk. And if somebody wants to educate me about why it's high risk, I'd love to hear it.
I'd like to respond to that. I'm not saying it's high risk. I'm saying it's the food code. We enforce, at the Health Division, we enforce the food code. The Massachusetts food code. We didn't write it.
Okay, the citizens of Concord would love you to take a leadership role and not simply say it's the code. This is what gets us in trouble with a lot of things. I mean, Susan, I'm sure that you and everyone else on the board has great science credentials. I would like to know why, not just it's the law, it's the rule. Let's, can we set an example, just like we did with single-use plastic, for something that has a greater good, which I think, and a low risk in terms of public health. And I'll be quiet because I am totally not a public health person. I'm an economist.
I would just say that there are public health codes for all kinds of things in the state sanitary code. We don't write them, the FDA writes them, who are food safety experts. And the only thing we can do as a health division is try to enforce them fairly and consistently across the board, because otherwise the enforcement of regulations becomes arbitrary and capricious. And so we do our best to enforce the code fairly. And you may not agree with that, but that's how we do things.
Yeah, I mean, I think we're getting a little bit off topic here, just sort of wondering why we're enforcing the laws that we're enforcing. I mean, I almost feel like that's like a separate discussion here. I think the more productive discussion tonight is probably what the steps the Board of Health can take. So I think we should focus on that. I think we should focus on, what we can do to be a leader in the state, to reduce plastic. So, because I think we all want that. I don't think anyone on this Zoom is opposed to that. So I think let's narrow down some goals here, and figure out, what our next steps are. Am I right, Jill?
No, I think that's reasonable. I just want to know if there's anybody else that has anything to add before we think about how we need to respond at this time. I don't see any other hands up. Am I missing anyone?
Janice Moritz has her hand up.
Yes, I'm Janice Moritz, 78 Southfield Road in Concord. I moved into this town right around a couple years before the water bottle ban, and I got on that bandwagon. I was ever since then all into getting rid of plastic. And so Deborah's offered that opportunity for me for rice. I got rice all the time, beans and spices consistently there with my same refillable container. Very important to me to have that option available in Concord or anywhere. I don't know where to go since COVID to get this done. Mm-hmm. I do get refillable things for shampoo and dish detergent and hand lotion things. There are stores I go to for that, but I'm at a loss with that. It's just as a person in the town here, I just so want this option to come back for me.
I also know that I often use a paper bag when I'm buying bulk grains and things. So I know that that's often an option. And I just, I don't want us to lose sight that another alternative exists for a lot of these products. But going back to kind of process, I see Jerry Frankel has a hand up.
Yes, thanks, Jill. Jerry Frankel, 132 Jenny Dugan Road, care of the Comprehensive Sustainability and Energy Committee. So most of the discussion, I think rightfully so, has been around public health on this topic, which is why it's brought to your attention. It was brought to our attention because of the sustainability aspect. And I just want to make sure that this is kept on the sort of the front page, so to speak, as well. We have a goal in town to reduce our waste stream substantially. This seems to be a relatively straightforward method of doing that. So I'm speaking up simply because I want to make sure the sustainability aspect is considered. Thank you.
Thank you, Jerry. Any other public comment?
I have a question.
Please.
I have a question for Deborah.
Can you state your name, please, and your address?
Yes, I'm Paul Gill, 166 Judy Farm Road in Carlisle. I'm a customer of Deborah's. And honestly, I don't know what you're referring to when you talk about a returnable. You have a very nice camera shot. Could you show me a returnable?
I'm in my home office. I don't have my jars around, but returnables are any containers that you might bring from home into which you put bulk food. We know cleaning products and beauty products are allowed. So, I have my mom's old glass jars from Arrowhead Mills that are probably 50 years old. And I would bring them in, fill them with oats, take it home, use it up, wash it out, bring it back. So that's a returnable. Gosh, so I have nothing on my desk that I can show you as a returnable, but returnables are containers from home.
Like a mason jar, for instance.
Yeah, a mason jar, but it also could be, an old yogurt container.
Deborah, thank you for that.
I'm sorry, I confused you.
Oh, someone's showing us nice spices.
Who has spices?
Oh, yes.
Melissa
you, Melissa.
Waiver is showing us views of spices.
So I could bring in some of my old glass bottles.
Yes.
If this was okay. Yeah. Okay, thank you.
Right, I saw a heart on Laura Davis's name. Did Laura want to speak? It wasn't a hand, it was a heart.
I still like.
No, I was just appreciating the view of the bulk goods.
Okay, thank you.
Yeah.
Got it. Any other questions or comments from all of our viewers online? Nina.
I'm not seeing it. Oh, Nina's hand is back up. Yes.
Hi, thanks again. Nina Huber, 83 Wright Road. Well, it sounds like Deborah and Janet would want our Board of Health to make some kind of statement to the state, sort of suggesting this. And I guess my question is, how do you all on the Board of Health, can you get behind that? Saying, citizens in our community have expressed this interest because, for all the reasons that they are, and we would ask you to look into changing the regulations. And then I have no idea I don't know what is involved in getting that regulation changed. But could the people on the Board of Health get behind that? And is that what Deborah and Janet are looking for?
I definitely am looking for that. I was brought up by a mother who was always a political activist, and she always said, if you see something and you think it's wrong and you want it to be changed, you need to speak up. So, I think our Board of Health are smart, dedicated people, and I I know that if this was not in the model food code, they would approve. So I do think that they should speak up and say, this is, our town wants us to be more sustainable. We know plastic impacts human health. What can we do to change that now? How can we help?
Yeah, I mean, I think, you know, it is in alignment with the sustainability principles that have been behind the water bottle ban, which came from the Board of Health, as well as, you know, polystyrene bans we've supported as well. And we also see, you know, the impact of that and the work it has created, but that's neither here nor there. So, I mean, I personally could see, you know, have no issue with sending such a letter. But that's the, you know, very beginning. And I think that there's so much more that has to happen at, you know, the state level, that, you know, the interdepartment, you know, work that happens between Department of Environmental Protection and Department of Public Health. You know, that's a lot of work. Mary White, I'd like to hear from you.
Hey, you had suggested paper as a solution. In the month of July, I joined a group called the Eco Challenge and signed up to prepare 2 meals a day with all ingredients not packed in plastic. I had no idea when I signed up for that it was impossible. You go into the grocery stores, everything is packed in plastic. The only cheese you can buy that's not packed in plastic is cream cheese. That's it. All breads are packed in plastic. Everything was packed in plastic. I had to buy bulk ingredients to make my own cereal for breakfast so that I could have at least 1 meal a day with no plastics. Fortunately, I have a vegetable garden that helped too. But I found one place where I could buy bulk goods that had little paper bags. They split when you try to fill them with the amounts that you need. Plus, Concord is trying to cut down on the number of trees, the tree canopy that's being taken down. So I don't think we can see using paper bags as an alternative to bringing your own. I have these beautiful honey jars, 5-pound honey jars that I've used for years to refill. And why should I be bringing a whole stream of paper bags home when I've got these jars that I could much more conveniently use?
Thank you. Okay, thank you. Janet.
Yeah, thank you. 618 Nurse Neck Hill Road, Janet Rothrock. One of the, we really radically have to change the way we live. We cannot use the throwaway products we have. We know we have a deadline. Plastic comes from fossil fuel. We have to stop using fossil fuel in the amounts that we have. One of the wonderful things about being able to bring your own containers to fill with bulk goods, even though it's a very small thing, it's a teachable moment. It's a time when the consumer or the customer can make a choice. And they may not think to bring their own container themselves that day, but when they see somebody else bring one, it may occur to them. If we don't start changing the way we live now, we are going to regret it terribly in the future. We know that. Where will it start? This is one way that's relatively easy and very low risk. As Mary said, you go into the grocery store, it's impossible practically to find anything or much of anything that isn't wrapped in plastic. And for anybody who's, say older than what, 40 or 50, maybe you can think back to when you were little and the stores were not full of this stuff. How was it handled then? We just can't keep doing what we're doing. And so we're asking you, who governs some of these things in Concord, we've already got a framework here. We've got sustainability principles. We've got a track record of some sustainability issues we've passed at town meeting. We would like to continue making inroads to do the right thing. We need your help. It probably has to, obviously it gets kicked up to the state level. We need to do something about this. What can we do? What's the next step?
Thank you. I see one more hand, Martha Stone.
Yes, hi, this is Martha Stone. I'm 42 Pine Street in West Concord, and I am Deborah's shop is my pantry. And I would like to point out a couple of things. One, it's amazing work that you're doing for the town, and also that Deborah is spending her time and energy doing this when it's so much simpler, I think, for retailers to make it easy for themselves. And one thing that attracts me to this topic too is that by allowing this in our town, I think it's good for business. There are a lot of aggregators online who are presenting these new options for refillable soaps and other products that go around your home. And at present, those businesses have the ability to siphon off our dollars. And if we're not able to do that right at home for a lot of different products, which is what Deborah's can do, and other stores in town as well can do, we also, I think, run the risk of harming our business environment. And I mention this simply because I think everyone on the call is in favor of this move forward. I don't envy you the job of trying to maneuver the state, but from a business standpoint, anything that gets ordered on Amazon is bad for Concord and it's bad for the environment, simply because of the cost of shipping these things all over the place. And so what we're able to do with some of our local businesses to keep them here and keep their products in refillable, reusable containers, I think is very good, strengthens our business community as well. So thank you all for what you're doing for us.
Thank you for those comments. I don't see any other members of the public offering comments. I do think that, the town, we have been supportive of the sustainability principles and we've integrated those into others. So this is, in my understanding, certainly in alignment with that. In terms of next steps, there's two things on the table, which is whether or not the board chooses to write to the Department of Public Health to start getting change in the works at the state level. That's what we can act on. And if the request is for a variance to the code, then that is a separate conversation that has to be formally requested and move to the next discussion, the next meeting. So I'm just curious from other board members, where your thoughts are on this, whether you feel like we could be writing this letter, whether there's whether we're in agreement with that. And I think, there's been some templates shared with us that we could use and we could adapt that with our own understanding of the issues if we want to move forward. But I'd like to hear from Mark, from Alma, what you're thinking on this.
Well, actually, I do have a thought, and it's all about as we see in Concord, the plastic bags have been replaced by paper bags or bring your own bag for your groceries going home. So I think of cross-contamination there always when I see this raggy looking bag in front of me being filled with that lady's nice groceries. And then I'm coming along with my food on the same counter. And there's definitely microscopic cross-contamination, I'm sure, going on. So how have that or the grocery stores moved from plastic bags to paper bags and being allowed to bring in these oddball bags that could be stored in a closet with sneakers or something? So I'd be interested to know how they made that move and can have that cross-contamination and it's not a problem.
Right. And in addition to that, there was a New York Times article last week that talked about the environmental impact of those canvas bags, and that they're really very heavy water consumers as well in the production, and takes many years for the, for it to have a neutral impact on them. So there's a lot of hidden costs in a lot of the products that we're using. But certainly there is a risk in contamination with a lot of those funky bags that people have.
Mm-hmm.
But I also haven't heard of anybody getting sick from that, honestly. So, we do live with a certain level of risks, and there's no doubt that we are, exposed to so much more in our day, which COVID certainly pointed out to us as we suddenly realized how contagious things were. Mark, do you have thoughts on?
Yeah, so a few thoughts. So certainly I'm in favor of the sentiment of, reducing plastics and being able to do something on this. I think I had not thought about the variance idea before tonight because it didn't even occur to me. And, it's maybe something worth thinking about. I mean, the way I view it is this is very different sort of legally and regulation wise than, for example, the water bottle ban, because we have broad authority to regulate additional regulations, right? But these are state regulations. We don't have authority to just kind of, ignore the state regulations because we think that, there's a better public good around the plastics issue. Sort of, big picture, maybe there are things where there is a variance opportunity that makes sense. I'm certainly in support of a letter if that's helpful. I frankly don't know that a letter from our Board of Health, I mean, it can't hurt, so I'm happy to do it, but I don't know that that's going to be the thing that's going to make a change at the state level. I think there's a lot of very involved and activist citizens on this call that can probably do a much better job than the Board of Health members on trying to promote change at the state level. Although again, I'm very supportive of that. So, happy to continue the discussion. I'm not sure that there's that much more that we can do unless there is some variance avenue that makes sense. And if there is, it's not going to be broadly applicable. I mean, the only way I think we could have a variance has to be very specific about very specific facts, which, unfortunately is every kind of case by case item. It's not, as Deborah's hoping, sort of, would just then open up the floodgates in town. I think it'd have to be very specific. I will mention one other thing, which, Deborah, maybe this isn't practical, but when I look at the regulation, it seems to me like if you have a group of customers who are very interested in this and you are willing to do it, it would seem like you could compliantly sell them all a particular type of reusable container. They use it, they bring it back, and it's sort of a trade-in because you've got the next one that they use and fill, and you take the containers you took back and you once a week or however you do it, you have those washed and sanitized in a way that complies, and then kind of sort of more of a a rotation system. It may not be practical, but I do think that that's something that the regulation, the way it's written now, would probably let you do it. More of a swap in. But beyond that, I think this is really a question of the state food code.
So may I just say, first of all, I think the squeaky wheel gets the grease, and I do think that it is worth speaking up. It may not shift things immediately, but if we are silent and we don't speak up, things won't get changed. I agree with you that the solution you've suggested is impractical, and then it doesn't allow Mary to bring in her 5-pound honey jars from home, or me to use things that I've been using my whole life. So we are introducing more waste into the system, which is, what we're trying to avoid. It also then presupposes that each business has a holding room where they can hold jars that are being, or containers that are being returned. So, I mean, there are a lot of reasons that I don't think that's a solution. But I appreciate it. And what I need to know is how do I ask for variance? And when I look at our bulk plan and the bulk foods we're planning to have next door, it's like 300, more than 300 different items. So do I need a variance for each one? For, sunflower seeds and sesame seeds and lentils and, dried mango.
Well, I think we can probably help figure out how probably the Board of Health can probably help you figure out how to apply for a variance in a way that doesn't, involve a tree of paper for each thing, each seed, each nut.
Susan, I believe you have those guidelines if Deborah would like them.
Yes, I do. It would have to be a specific proposal for what products she would want to allow people to refill returnables brought from home, and how she would protect the public health so that dispensers don't touch one person's thing and then another person's thing, and therefore avoid the cross-contamination issue.
Right, and there has to be justification, I believe.
Right.
Okay.
Someone else has their hand up, Jill.
Yeah.
Nina has her hand up. Again, are you done with public comment? I don't know. I just saw her hand go
I'd
back
say
up.
this will be the last of the public comment and we need to move on. So Nina, if it's something different from what's been said, please. But you have to unmute yourself. Yeah.
Thank you. Really quick, just it occurs to me, if these other towns that people have mentioned are sort of doing this, maybe a more impactful notice to the state would be if it was done collectively, if some citizen or something, a group effort, so that it could be kind of a group letter, maybe. Just putting that out there. Thanks.
No, I appreciate that. And I know that when Deborah brought this to the Board of Health, you've mentioned, Deborah, the other towns doing this or other stores, but you've not been able to share that with us. So we don't know where this is. It's not apparent to us where this is happening. So unless there's anybody forthcoming about that, then we don't know who to talk to. So our hands are kind of tied on that one. But, Deborah, if you want to work with Susan on finding out how to do a variance, the information is there. And I guess for my fellow board members, I mean, if we would like to craft a letter, we can do that. And I am in agreement that it's important to speak up, but, we'd be a small voice in this, but it's a start. So, Karen, do I need to make a motion that we will follow through on that letter, or?
If we're going to, tonight we said we weren't going to take any
Right.
votes, if you remember.
We did say that.
And actually, I don't think voting on a letter that doesn't exist makes sense. So I think what I would suggest is that, if we have a letter drafted that we can then consider at our next meeting, we could do it that way.
Okay. I think that's reasonable, and we can work with what we have, and Susan, I can work with you and share that with the other board members on that, if that's appropriate.
And we're drafting a letter to the State Department of Public Health to inquire about changing the specific issue about returnables. Is that what, I want that for the record. Is that what we're going to draft?
I believe, and to encourage conversation with the Department of Environmental Protection to coordinate the the goals that both organizations,
Okay.
both agencies have. Is that right?
Jill, can I speak up for a minute? So the Board of Health and the Department of Environmental Protection are meeting. They are speaking once a month with each other. So I just want to be clear.
Okay, and we can just encourage that continued conversation,
Yeah.
then, you know, and support that conversation and that they find common ground on this one.
Yeah.
So we will draft that and bring it, and it will be presented at the next Board of Health meeting, which we figured out was October 13th. So, okay. All right, thank you everybody for your thoughts on this. We need to move on to the next item, which is tobacco control. There's been a new tobacco control compliance officer, Ian Worstel. And Susan, do you want to fill us in on this, please?
Sure. So you may remember our former tobacco control officer, Erin Murphy, who provided you with such nice reports. She worked for the Regional Collaborative for about 1.5 years and primarily did education, because you may remember that the state law changed, raising the minimum sales age and prohibiting flavored tobacco and vaping products. And then COVID, well, it changed. It was due to be enacted or become effective in June of 2020. And then COVID hit and the world kind of blew up. So once she got hired, she sort of started the education process with the tobacco retailers all over from start, even though I had started that process before COVID. And then she left us to take a full-time job, and we have hired a new person. So he's ready to get out and start doing the compliance checks, which is the enforcement piece of it. And I just wanted, well, one, to ask you, the town manager appoints health agents. I wanted to ask you to make a request to the town manager that he be appointed an agent of the board. And I think that protects him and the board legally if he sends order letters on your behalf and issues fines on your behalf. He should be an agent of the board who's been appointed by the town. And also, I wanted to remind you of the different fining structures. The fining structure from your local Board of Health regulation is $100, $200, and $300 for the various fines. But the state law is considerably, the fines are considerably more expensive, and that's mandated by state law, not by you. So the new fining scheme is $1,000 for first offense, $2,000 for a second offense, and $5,000 for a third or subsequent offense within a 36-month period. The new fines apply to violations regarding sales to persons under minimum legal sales age of 21 and sales of flavored tobacco products only. So I just wanted to remind you of that fining structure and look for your sort of acknowledgement of that and your blessing that you want him to do compliance checks that will involve fines.
So we need to take a vote to recommend his appointment. Is that correct?
Yes.
First part, and then the second part is whether we agree with the state fine schedule.
Well, you can't disagree with it, but you can want him to do compliance checks or not, where fines are issued.
Okay, so it's the compliance checks of the second part. Okay, so can we take a vote on, do we need a motion to take a vote to approve him?
Just a motion to recommend appointment.
I move to recommend appointment of the new tobacco control compliance officer.
A second.
Thank you, Mark. All in favor, Alma?
I approve.
Deb?
I approve.
Mark?
I approve.
And I approve. And do we want him to do compliance checks?
Sure.
Seems like that's why he's here, right?
Yeah. Get out there.
Get out there. And this is, the vendors should have seen this coming, right? That, they've had a lot of time to get ready for this one.
Yeah.
So are we then, I need a motion to approve that he continue compliant or that he conduct compliance checks.
I think it wouldn't hurt to have that on the record.
I would move to have him start compliance checks.
I'll second.
And Alma, how do you vote?
I approve.
Okay, Mark?
I approve.
Deb?
I approve.
And as do I. So he has his marching orders.
Thank you.
So
Thank
this
you.
will go to the town manager now, well, because he appoints him officially, but.
But it's great. I mean, we need to have somebody in place. And I think that there's been, since COVID hit, this has been such a, under the radar topic. And I think it's great to bring it back.
Yeah.
So that's great. Okay, next on the agenda is just the board calendar for the remainder of the year. Our next meeting is October 13th.
Which is a Wednesday, everybody. If you remember, Susan's gonna be on vacation the following week, so.
It's good for me.
When I first moved it, we were gonna be meeting in person, but now we're back to Zoom land, so it will be likely via Zoom again.
Unless anything dramatic changes.
Unless anything dramatically changes, so I will let you all know what that is.
Okay.
So thank you. We received the July minutes today, so we're not going to assume that anybody has reviewed them thoroughly yet. So thank you, Karen, for getting that to us. Next we have board member reports. If there's any items that anybody has to report?
Not from me.
Mark?
Thing for me.
Okay, and neither do I. So then Susan, if there's anything else from you, we'd love to hear.
Nope, I think that's it.
Wow. Well, I really want to commend the health department staff who've just been working really, really hard this past year and a half, maybe longer. And this is a late night meeting for you guys. So thank you for all that you guys have done for keeping the community safe and healthy and looking out for our best interests. So it's noted by us. If there's nothing else, then I believe we can adjourn the meeting at this point. Do I have a motion to adjourn?
I move to adjourn the meeting.
Second.
Not too eager there, were you?
No.
Long day for everybody. All in favor? I'm in favor. Alma? Mark?
I say aye.
Aye.
All right. Well, thank you to everybody that joined in tonight. It's really great to have such an engaged community bringing all of these subjects to us, as hard as they are. We do appreciate that everybody's, concerned about our health and environment. And, thank you for your time tonight and for all of your comments and thoughts. So have a good night, everybody.
Good job, Chair.
Thank you,
Good
Jill.
job.
Thanks. I hope so. I hope it's okay.
I'm gonna be on TV tomorrow.
Right. Natural.
All right. Yeah. Well, great.
Thanks so much.
All right. Thanks, everybody. You have a good night's sleep. Okay. Bye-bye.